Hi everyone. We have a global pandemic of COVID-19. Today, I'm going to teach you a method that you can use at home. You can learn quickly to treat yourself or your family by using a very simple tool, something like this. This technique called Guasha. So you may ask, why Guasha? Because we need it at this difficult time, and also because this technique has been used for many years in China with good effect, including infectious disease. And also because recently it is used in China with good success, and I personally treat a patient in UK by remote instruction. So you can learn it at home and use it by yourself. Guasha literally means scraping sand. So in this technique, you treat disease by using a tool to repeatedly scrape or rub specific skin area until bleeding of capillary appears. So they look like red dot sand. So it's based on Chinese medicine and particularly the meridian theory. It's widely used in the countryside because no medicine is required, and because of its quick effect. Recently, people use it for treating some difficult disease. So why Guasha works? It's mainly based on acupuncture meridians. So you can regard it as a non-invasive acupuncture treatment. Although there's not many modern study, but as you can see, the wide stimulation of the skin can stimulate the peripheral nerve system, may affect the lymphatic fluid and the blood circulation. It can also improve immune functions. Based on the symptoms of COVID-19 patient, we think that this disease mainly affects the lung and the digestive system. So the treatment also mainly targeting to these two systems, but need to be tailored to the specific condition of the patient. There are different type of tools for Guasha, but if you don't have them, you can just grab a spoon in your kitchen and get some vegetable oil and start working. This video demonstrates how to do Guasha on the forearm. Pay attention to the angle, speed, and the direction. Specific region of the body is selected for Guasha, which is mainly based on symptoms and the diagnosis of the disease, which is very critical for the effect. So for the mild or moderate type of cases of COVID, we list the 4 regions, which we will go through. And also for the more severe region, we can use more Guasha area, but you also need to talk to your physician and visit your local hospital for treatment. It's more beneficial to use more regions if the patient can tolerate the stimulation. You can learn further information from the internet about the channels and the meridians. So the first is the lung meridian. The figure shows the running of the meridians. For the mild case, you can just do the green arrows. Pay attention to the blue circles area. But if the patient is more severe, you can do the yellow arrows. So that includes the whole channels. and the figure in the middle shows how it looked like of the guasha on this meridian. Then the second is on the back. The three arrows, red arrow shows the location of the three important points you can use, and you should scrape from up down along the three green arrows. The third region is on the chest. So for the mild case, you can just do the midline as shown between the two red arrows, and you should follow the green arrow, and in the middle you can see how it looked like after guasha. But for more severe case, you needed to do guasha on both sides of the chest and follow the ribs, try to see the guasha effect on both sides. Then the last meridian is the stomach. As you can see on the anterior part of the leg, you can follow the green arrows between the two red arrows. Again, pay particular attention to the blue circles of the leg. Then here shows more severe cases. Patients, you can do heart, pericardium, meridians, and on the middle, on the right side is the large intestine and the Sanjiao meridian. These are important channels for the more severe cases, moderate or severe patients. Then on the leg, you can guasha on the spleen and the bladder channel as shown on the figure. Then on the back area, you should expand your guasha region to cover the whole back area, because this region include some very important acupuncture points which are related to the visceral organs inside. So stimulating this point is very important for regulating the vital function of these organs. Next, we will discuss how to use it. So in general, you can give strong stimulation for patients who are strong or more severe acute condition. Vice versa, you can apply guasha once daily in the early stage of the disease. But in general, you need to wait for the red spot to disappear, then you can apply guasha on the same spot for a second time. So for each area, you usually do about 10 to 20 times, but the rule is that you wait until the maximum guasha appears. So there's no absolute number to follow. For meridian, we needed to do in segment of short scraping so that we may cover the whole meridians. For arms and the legs, we need to scrape to the tip of fingers and the toes, which is important. And you need to use gradual and penetrating force and making it tolerable to the patient. And the speed also need to be moderate, not too fast. And you need to go to one direction, not go back and forth. So the calming of the Sa is also an indicator of the disease and the treatment effect. So for example, if a patient has a strong or severe disease, they often has dark and quickly calming of the Sa. In contrast, a healthy person, you don't see this sign. But however, in weak patient, you may not see the calming of the Sa, which suggests either the disease is very severe or the patient is too weak. So you can look at the appearance of Sa to judge the disease condition and the treatment effect. Here I list contraindications for Guasha. You need to be careful in these patients. Also, you need to be careful with the caring of the patient after Guasha. So here we discuss some general rule. Eating is important. If the whole back received Guasha, the patient should not eat for 1 day, but they can drink some sugar water during that time. Otherwise, it's okay for patient to eat, but do not eat too much. There's also some other aspect you need to pay attention to. Here I introduce a case. I instruct the patient to treat herself. So the girl is actually a Chinese student in UK. She is my relative, and she has the symptom which looked like COVID-19. So I gave her instruction on the phone, and she did everything herself using that stainless steel spoon, and you can also see how she did that, and the effect was pretty good. She did this for 3 days, and she become almost totally normal. So that suggests that Guasha is effective and useful for COVID-19 patient. However, we don't have experience for severe patient. It's also possible to use Guasha for the prevention of COVID-19. Basically, you can use the lung and the stomach channel we introduced earlier and follow the procedure on the slide. At last, I would like to emphasize 3 aspects. One is early intervention, which is very critical to achieve good effect. In fact, this is also possible because you're at home likely, so you can do it earlier to help yourself and help your family. The second, you need to have confidence in the technique and also in yourself. Give it a try. The third is you need to do it correctly because the effect is totally depend on how you do it. So if you have any question or you have successful story to share, please email me so that we can help more people from our experience. Thank you for watching. Good luck.